So we've got Dr. Jennifer Bowden with us here today, and she talked about perimenopause and estrogen's effect on the body, which was really a pretty insightful conversation. I want to start by asking you, a lot of patients are coming to us. What percentage of our patients are likely having some effect from declining estrogen?
Probably about 22%. So almost a quarter of the people that are coming to clinic are having some of these symptoms, whether they recognize that they're estrogen related or not.
Yeah, probably often not for us providers and for the patients. So
both, yes.
That's a fantastic correlation for us to know as providers, and then also for patients to be a little bit more aware that this may have an effect. One of the big things you spoke about was just how vast and how many symptoms can be correlated with declining estrogen, and especially a lot of those are related to orthopedics and neurosurgery. Can you talk about a few of those that we might under-recognize?
Yeah, I mean, the one that people might most often consider is osteoporosis because, you know, you do get the drill of, oh yeah, estrogen can decrease bone density and so you have a higher risk of osteoporosis. So that one usually sticks in, but they may not recognize that their joint pain is estrogen related. So that low back pain that nothing's showing up on the MRI and they just had a drop in estrogen levels and their pain increased could be something to consider on both sides. There's an increase in headaches and migraines that is just, you know, you think about, oh yeah, there are hormonally related headaches, but if you're perimenopausal or postmenopausal, you might think, oh, but I'm done with that. Why do I have a headache? But that change in estrogen levels can still be influencing that. There are things that can be really just not obvious that they've had something like, say they were in a car accident and then they are really okay, you know, had some challenges, but they're hyperreacting to that for a really long period of time.
Yes.
And the providers are like, well, you're really okay.
A little baffled,
getting better, and why is this seeming so bad? And it's because their brain has just kind of gone a little bit haywire and they're not able to cope with that situation.
And then for our patients, kind of what age range can we typically, obviously there's a lot of nuances, but typically expect that they might start to have some of these symptoms?
So generally 40 to 65.
Okay.
And you think about, you know, the actual date of menopause is supposedly in the early 50s, 51, 52, but that doesn't mean the symptoms are going away. Yeah. They actually sometimes intensify.
Yes.
So
yeah, great information, something for our patients to be aware of. You know, are you in that age range? Could that be playing a factor in your pain? And then lastly, what can our patients do about it?
So that's the complicated part.
Yes.
Because every woman is different. They experience different things. Overall, big picture, healthy lifestyle makes an impact, especially exercise, because that helps both physically and mentally. A healthy, well-balanced diet, getting in some extra phytoestrogens, so like soy, walnuts are some easy ones to get into your diet, helps a little bit. It's not going to be an instant big fix. And so recognizing that this is a work in progress and working with your healthcare providers in all of the aspects of your health is important.
And we talked a lot about how they might not necessarily see the benefits of that exercise in a visible way, but how important it still is for our patients to do that and how it can help a lot of the other symptoms.
It is, and helping them look past things like, I'm exercising and I'm gaining weight, what's the deal?
Yes.
To say, you're exercising and you are helping your bones to maintain a little bit more density and you are helping your muscle mass to stay a little higher and you're doing good things to your brain.
Yes. Yeah, and it can be frustrating because what worked so well from the before may not work now.
It might
but
not.
It is still having a really positive impact on their entire overall health.
Definitely.
Well, thank you for your conversation.
Thank you, Brandi.